Hello, everyone. Welcome back to the Dear Future Pharmacy Talk Show Season 2. For the final episode of the season, we have two inspirational inpatient pharmacists and students joining us today. First off, welcome back to our channel, Dr. Nguyen.
Thanks, Ryan.
Yeah, it's good to see you again. Again, be sure to check out our collaborative series with Dr. Nguyen. It has some great advice and wisdom from the empowered pharmacy herself. Also, check out her most recent project with Dr. Sally on Hey RX Friends. We got this podcast. I would highly recommend it to go give a follow and see. It's a really great and chill podcast that you can just listen into and get some insight into pharmacy in general. We also have a current P4 student at WesternU who's currently an intern at Children's Hospital at Orange County. Anna, welcome.
Hi, thank you for having me.
All right. I hope our episode today will bring out great insights into the life working in inpatient setting, as well as things in regard to residency. Without further ado, let's get this started. So, Anna, what actually got you initially interested in pharmacy?
Yeah, so as an undergrad, I was a biochemistry major. And I realized when I was taking organic chemistry, I really enjoyed that class. And so I was also doing biochemistry research during that time, specifically pharmaceutical research during my undergrad. And I fell in love with just how the body works when it comes to, to medications, as well as how the medications work with the body. And I knew that the closest field would be pharmacy. But it wasn't until later on in my undergraduate years when I realized this. And during that time, I also did a lot of medical mission trips out of the country. So one of them I went to Cambodia, and then the second one I went to Mexico, in which I both volunteered at the pharmacy section at the medical mission trip. And then I realized that that was a really rewarding experience, but I understood the importance of medications in patient care, especially even if you have the best physician, clinicians, nurses. It really does come down to the resources and the medication that is available to treat the patient. And that's what brought me into being interested in pharmacy.
Sounds great. Having that early exposure definitely really help boost the interest or like to kind of solidify the thoughts on pursuing a career in pharmacy. And I'm really intrigued of your experience in Cambodia and Mexico. Would you mind telling me a little bit more of that?
Yeah. So I actually partnered up and went with two different types of organizations. One of them for the Cambodia was Sustainable Asia. I actually had one of my professors at Cal State Fullerton, which is my alma mater for undergrad. He was actually one of the advisors for the organization. And so he really introduced me to that. And I took advantage of the opportunity, raised my own money, and was able to go over there. It's a nonprofit organization. Everything is completely free for the residents there. So we set up a free clinic and provided the patient care for the individuals there. And it was very similar to the Mexico medical mission trip where I partner up with an organization called Flying Samaritans. And we would drive out to El Hongo, Mexico every first Saturday of the month. And we would set up this free clinic and provide care for not just the residents there, but also we volunteered at the orphanage, bringing not just medications and care over, but also food as well. And essentially, everybody was volunteer, the physicians, the students, the nurses, even pharmacists were all volunteers there. So it was such an eye opening and, of course, humbling experience for me.
All right, perfect. Let's move on to Dr. Nguyen. Would you mind depicting your overall journey in pharmacy so far, and just kind of give us a brief reintroduction of what you have went through? in pharmacy so far?
Sure. Yeah, I went to pharmacy school and graduated in 2014. So it's been almost 10 years since I've graduated, which um, has been kind of a interesting journey so far. One that I didn't really expect from the beginning when I first stepped foot in pharmacy school to even now. So things are always changing, and it's been yeah, it's always been interesting. So that's always fun. I would say expect the unexpected if I were to give any advice to any of the students or residents right now is healthcare is always changing. And so be aware of what you can do to help it and remember your why as to why you're in pharmacy. And yeah, Anna gave a really great example of why she wanted to do pharmacy. And she obviously has a very strong interest in the profession itself. And I hope that anybody who's listening is aware that, healthcare is difficult and is a very challenging career in the sense of the healthcare system is never what you want it to be. And sometimes you feel like you're fighting against a system that's already existed and having to find loopholes to help your patient, which is not the best. Sometimes you feel like you weren't provided the best information in school. And I'm not talking about clinical, I'm talking about how to actually handle yourself when you are practicing. I'm talking about managing expectations of what a healthcare provider should look like, all the limitations that were set on you because you're a pharmacist. I don't think school prepares you very well for that. And so this is why getting an internship or taking advantage of rotations, those experiential rotations are really important. But it's still a very fascinating journey, and I'm learning so much as I go. And I hope that everybody keeps their minds open and continue to feel the passion for your career because you do spend so much time in it throughout your life, and you want to make sure that no matter what, all the ups and downs, that you still somehow find the interest in it and you do find the fascination within it. So that's my little spiel for you.
Perfect. I mean, it's a great summary to like, a lot of things that can happen in pharmacy and, just gonna keep on, going. Um, and I'm aware that, during the time, maybe you just finished school, Dr. Nguyen, um, it was difficult, to find yourself and what kind of things you want to step foot in. And one of the things that I think you mentioned, in our previous recordings is that uh, it was one of the rotations that got you interested in inpatient pharmacy. Would you mind telling me a little bit more about that?
Yeah, I mentioned before that I've always thought that I wanted to do ambulatory care. I thought I wanted to practice in a clinic and do patient education as my career, like a full-time thing. And when I was actually on those rotations and working in an internship that was mostly ambulatory care focus, I never received the types of feedback that really encouraged me to keep going. Like it was very lukewarm feedback, basically. And I didn't really know how to get better or how to improve. And this whole time I thought, oh my gosh, maybe I'm just not smart enough for this. Like maybe other people are better than me. And I was really down on myself. But then when I set foot into an ICU rotation, which you would think just, from what your initial thoughts are that ICU would be so much more difficult than ambulatory care, but I loved that rotation. I just thought that this kind of a little bit more fast-paced environment where I really get to see patients' labs all the time. I get to have control over what patients take, what medications they're going to get, and being able to check on their vitals all the time. That kind of feedback loop for me was the best thing that I could get on a job. I really needed that to tell me, okay, you're doing something good, you're doing something right. And I needed that kind of more constant validation. And so I just fell really in love with that setting. And then just in general, acute care, because I just got to see so many cool things about medicine that I never got to see in an ambulatory care setting. And now I'm not bashing ambulatory care because everybody has their own unique aspects of a job that they really love. And for me, getting to see the magic of medicine happening so quickly, you know, you give somebody an antibiotic and they get better 6 hours later. They're, you know, extubated a day later, and now they're walking around like 3 days later. I'm like, this is a miracle. And I love seeing that. But then there are people who love experiencing that chronic disease states with their patients. And so everybody has the thing that drives their passion. And for me and for you, it's going to be different. But you know, be open minded and try it all out. But that was a little bit of a challenge because I thought I wanted to do something. Turns out I was completely wrong. And, you know, you just got to go through that journey of figuring it out. There's no easy answer, unfortunately.
Wow, I mean, that remind me of, like, last time we mentioned, part of the journey of trying to find yourself in different situations and trying to expose yourself to, different fields before you kind of make a decision. And when I always heard about your story, or revisit your story, it's always fascinating on how, maybe just one rotation, just that experience really changed what you do, um, for the rest of your career. How about you, Anna? I think what got you interested in pursuing career in inpatient pharmacy?
So it's really interesting that you brought up the different types of careers, and you actually initially came in thinking that you wanted to pursue a different career. So I actually came into pharmacy thinking that I would become an industry pharmacist. And so I actually pursue and work with IPHO, which is the Industry Pharmacists Association, and I was really involved in them. My first year, I did the VIP competition, and we actually went all the way to nationals and even got awarded. And I really enjoyed it. And even till now, I'm still doing research in pharmacy school. But what really got me into discovering that I'm interested in inpatient would be my position at Children's Hospital of Orange County. So I know a lot of inpatient pharmacy interns don't get the luxury of working clinical. A lot of times when they get into those positions, it's a lot more tech work than clinical work, and that's just because of the volume of the, just the need and where we need the interns to be. But I was very lucky to be at Chalk, where there was an entire intern program dedicated to really helping and transitioning interns into their clinical role. And so by second year, I got in my second year, but little less than a year, I was already transitioning into clinical role where I was monitoring PK for antibiotics such as vancomycin and aminoglycoside for patients in NICU, med-surg, and oncology. And then I also was monitoring medications for renal adjustments and anticoagulant. So I was very submerged into clinical work, even before APPEs. Even before I even started my IPPEs, I was already doing clinical work. So it was very rewarding, and I found out how impactful pharmacists in the inpatient setting was. And it's true, Dr. Nguyen talks about how just when a patient gets put on an antibiotic and how quick they recover. And what I also found out that in school, they really don't teach you a lot of the disease states that you see in special populations. And I was able to really experience that at CHOP because it's a pediatric population. They don't teach that in school. And so a lot of the disease states, such as HUS, which is known as hemolytic uremic syndrome, we don't get to learn that in school. And so I actually got to learn that in my work setting. And that really drove me even farther into wanting to do clinical, wanting to be an inpatient, because I was gaining so much knowledge. And every time I come into work, and that's why I want to pursue inpatient pharmacy.
Sounds great. And I love that you mentioned, your experience working at Chalk. As a local OC person, I definitely see, the significance of Chalk, influence, especially on the pediatric population around. And it's really inspiring and seeing how, everyone is so committed to um, help these patients. And I'm glad you got that experience and you got that exposure early on in your pharmacy career, Anna. Um, and I think a lot of pharmacy student would definitely like what you have experienced. Um, okay, moving on to a little bit about residency, right? And I know that you just recently applied for residency. Maybe describe a little bit about your dream to pursue a residency. What is the application process like, or as well as any like thing you're looking for in a residency program, if you don't mind sharing.
Yeah, of course. So I am in the process of applying and interviewing for residency. And what I do look in a residency program is the autonomy of the rotations that's provided in the program. But on top of that, the types of rotations that are provided. I know, for example, not a lot of programs provide an investigational drug component, but a lot of the programs that I looked into actually had investigational drug rotation. Some of them even had it as a longitudinal rotation for the entire program. And that's just because my interest in research really translates into also the types of programs I'm looking into. And additionally, a lot of the programs that I'm looking into are pediatric programs. Um, they are heavily focused on research just because there isn't a lot of research out there in this population. And so looking at the types of research they've done in the past, the types of residents where they would be able to either pick from a list that research has already been made for them and just the path is there for them to take, or they can have the autonomy to create their entire research on their own. And just the ability to have that was something that I was looking in a program for. So, a lot of the programs I talked to, a lot of the residency directors, and even the residents, I really asked about how they are liking the autonomy, but on top of that, their research project and how they're preparing for that. Additionally, I also am very interested in critical care. So, a lot of the programs I looked into had very strong focus in critical care, such as a trauma center, specifically trauma one level, and even a high level PICU or high level NICU. That was something that I was looking into for these types of programs. And for me, it's been such a rewarding experience to learn about the programs and network and talk to these different individuals who are already in the path in which I want to pursue as a resident. And so just learning from them and learning what is out there, and the opportunities that I can explore is very, very nice to know that at least like my school really pushed us to pursue higher level training, and so I'm very looking forward to the next chapter in my career.
What about you, Dr. Nguyen? I think, uh, would you mind, starting off reminding us of your residency application, and what was the process like? And were there any like favorite memories of you during residency or practice?
Yes, so I actually ended up doing a residency or completing a PGY1 at a brand new PGY1, and I was its first resident. So, in a way, I got to be the trailblazer for that residency program, which looking back, when I was applying for residency, I was looking for ambulatory care focused rotation. Focus residency programs, and then realized that I didn't actually want to do ambulatory care, but I wanted to do acute care. And then I told this story many times, but I didn't match initially and then scrambled to this brand new program. And looking back at that whole experience, that whole journey, which I'm sure I shared in our last thing together, so people can go back there and watch it. But I it's interesting because of everything that ended up happening. I was really meant to be in a program like that, to be the first that doesn't necessarily have all the structure that maybe somebody else may need. That I kind of like being able to be the first one and being that guinea pig and really set the foundation for what the program is supposed to be. And for me, that was kind of an exciting thing too. Um, and so I guess this is a good reminder for you guys going through residency application process is that sometimes you may get rejected or sometimes you may really want a program. You may really think that this is something you really want, but not to be like super hippy dippy, but there is a reason why you end up where you are. And it's somehow because of the way that you portray yourself. And if you portray yourself authentically and the program is portraying themselves authentically, you will somehow get matched up with probably your best fit. And as long as you guys are being honest with each other about what you can bring to the table and all of this stuff, there's a very good chance that another program will see you and they're like, you are part of us. And it shouldn't be this huge fight in a way. Um, and I know that is so much easier said than done because all of you are probably so anxious about where am I going to interview at and how am I going to do well and how am I going to answer these questions and how do I show up and how do I show off and all these things. But obviously prepare and practice and run your interview answers with people that you trust to give you the best feedback. But just know that it kind of all just work out the way that it's supposed to work out. And even then, sometimes it doesn't. Like just because you do get accepted at a residency program, it may not even mean that you may complete that program. I know it's really scary to hear that. You just don't know what's going to happen. The only way that you know how to move forward, I would say, is to trust in yourself that you can face any adversity that you will be met with. Whether that'll be kind of a toxic work environment that you did not expect, because everybody puts their best foot forward when you first meet them, and then you show up and it's actually this toxic situation, which has happened, and people have told me their stories, or whether maybe your RPD, which is your residency program director, gets pregnant and then she's on leave for 3 months and you have nobody to go to for certain problems. That's happened to me twice. I did a PGY 1 and PGY 2, and both women were pregnant like early on in my residency year. Um, or maybe something, you never know what's going to happen. So I would say do your best to be as prepared as you can, but the best way to also know that you're going to be successful moving forward is that you can face adversity head on and that you have a strong mental health on you. Mental health is so important, especially because I've dealt with residents who really struggle with anxiety, especially receiving feedback. Um, you have to get feedback when you're in residency, and that's the only way that you're going to grow. Like, how do you know what you're not doing well, or how do you know how else to be even better if you're terrified of doing something wrong in the first place or terrified of getting any kind of constructive feedback? You have to receive that. That's how you grow, but receiving it means so much pain sometimes. It's like scary and it's painful and you take it so seriously and you internalize it. And I'm telling you right now, like, learn to take those feedback because it is so crucial to your growth. I would say it's a red flag if you just fly through your rotations without any kind of like, I think you could do better if you do this. If your preceptors are not telling you how you could be better, then you're wasting your time. uh, like, I'm being a little bit dramatic, but yeah, I really truly believe in that. And so hopefully the advice will help. But I've said this before, it doesn't matter what happens, it matters how you deal with the situation. So remember that moving forward with everything.
All right. What are your thoughts, Anna?
I just want to say I needed to hear that. I feel like during this process of applying has been so gruesome. And sometimes I go through like process of imposter syndrome and realizing that the programs that I'm aiming for may be a little bit like too high, but I like questioning myself and then constantly going through the cycle of, am I going to get even an interview? Like, am I going to even do that, like, that step out of this uncomfort zone to even get an interview? Of like, this whole waiting process has been really gruesome, but just hearing from someone that has gone through it and it came out of it still successful and is happy where you are is so nice to hear and refreshing, because I feel like right now everybody is stressed, or at least like my group of friends who are all applying for residency, we're all talking about how stressed we are. But I think just hearing from someone that has gone through it and is successful and has gotten where they want to be, even though it wasn't something that they initially came in to do, that's so refreshing to hear. So thank you, Dr. Nguyen.
Yeah, you're welcome, Anna. I know. I wanted to give people a different perspective because I know a lot of times when you guys ask, your mentors or you go online and you get all this, I guess, advice about, well, you need to look for this specific thing in your program. Like they have to have this and they have to have that and they have to very specific things. And sometimes I feel like that is so specific and it doesn't give enough leeways for mistakes. And I think that mistakes happen and you, like failure is part of life. And if you don't allow that to happen, you don't allow yourself to fall flat on your face for just a little bit, you're gonna react to adversary so much harder. And I don't want you guys, like, that's the thing that hits me the hardest when I go through this is this failure, like this fear of failure, terrified of making a mistake, and then keep screwing up anyways because you guys can't handle like each time you make a mistake. I've had students in my office where I'm giving them feedback, just giving them advice on how to be better, and they're so anxious. And I'm like, it's okay that you're making a mistake. It's okay. Um, so yeah, I just want to give you permission to fail a little bit and just know that you've already gone so far. Like you're gonna get back up and you're gonna still get where you need to go. That's just life. And I just want to give that advice early on because I don't want you to have a panic attack when you didn't get, you didn't match with the program that you wanted because, you had this idea in your head. Like it's 1 year and then you can move on and do something even better. I'll tell you something. I applied to 8 programs and I obviously didn't match initially, but a lot of them were VA programs. And I had this thing in my head. I'm like, I'm not good enough for the VA or whatever. And now I'm working for the VA. So I'm just saying that life doesn't make sense sometimes. It's not linear. So be okay with making that mistake. But yeah, that's what I'm here for, is to remind everybody that it's okay to fail because obviously I survived it and what doesn't kill you makes you stronger. So
Great advice, great advice.
Thank you.
So, to conclude our episode today, any words of advice for the pharmacy students and pre-pharmacy students who are watching? Dr. Nguyen, you can go first.
yes, my advice for pharmacy students and pre-pharmacy students who are watching would be to remember why you are in pharmacy and make sure that you build a strong passion for the profession while you're in school so that when you start practicing that passion follows with you and it helps you make the decisions that you need to make to get the career that you deserve and that you want. So remember your whys and remember to stay resilient with that.
Anna, how about you?
My advice for at least current pharmacy students or incoming pharmacy students is to really take a lot of the opportunities that are coming your way. I really, when I applied to Chalk as an intern, Initially, I thought I there was a lot of better candidates than me, and I feel like I go through that cycle of imposter syndrome and questioning if I'm good enough, but believe that you are. And I'm currently learning that right now and coaching myself through that as I'm applying for residency. But I think not comparing yourself to others is so important because this is your journey and this is your path. And creating your own path and knowing that everything happened for a reason is very important. And always take the opportunities that are coming for you because you never know. It might be the best decision or the best opportunity you took that really paves your path for your future career.
Thank you, Dr. Nguyen, and soon to be Dr. Pham. As always, hit the like if you enjoy it and share this episode with your peers. Click the subscribe and notification bell for our latest content, and go give a follow on our social media as well as our guests' respective social media as well. There'll be the link to the podcast hosted by Dr. Nguyen and Dr. Sally. Thank you for everyone for watching. We'll see you next season on the Dear Future Pharmacy Talk Show.